Okay, so my topic is coronary artery bypass surgery. The surgery is the most common type of heart surgery in the United States. There are more than 500,000 procedures performed each year. For the rest of the presentation, I will refer to coronary artery bypass surgery as CABG. It's just a shorter way so that I don't have to keep repeating it. This is a procedure to treat coronary artery disease in certain circumstances. It creates a new route called a bypass for blood and oxygen to reach the heart. One way to treat the blocked or narrowed arteries is to bypass the blocked portion of the coronary artery with another piece of blood vessel. Blood vessels or grafts used for the bypass procedure may be pieces of a vein that is taken from the legs or the arms, and it will be put in the chest. At times, an artery from the wrist can also be used. It's not too often. You won't see that a lot. One end of the graft is attached above the blockage, and the other end is attached below the blockage. So the blood is rerouted around or bypasses the blockage through the new graft to reach the heart muscle. This is done. So the test is a surgery, so the first step is to go under anesthesia. The chest will then be opened in an operating room, and the heart is stopped 4 times so that the surgeon can perform the bypass. In order to open the chest, the breastbone, aka the sternum is cut in half and spread apart. Once the heart is exposed, tubes are inserted into the heart so that the blood can be pumped through the body during the surgery by a cardiopulmonary bypass machine. It's also known as a heart and lung machine. The bypass machine is necessary to pump blood while the heart is stopped and kept still in order for the surgeon to perform the bypass operation. While the traditional open heart procedure is still performed and often preferred in many situations, newer and less invasive techniques have also been developed to bypass the coronary blocked arteries. It's called an off-pump procedure, in which the heart does not have to be stopped, and it was also developed in the 1990s. Other minimally invasive procedures, such as a keyhole surgery, is performed through a very small incision, and robotic procedures, which are performed with the aid of a moving mechanical device. Those are being used more often. The procedure is performed if you have a blockage in one or more of your coronary arteries. Coronary artery bypass surgery can be used to improve blood flow to the heart, and your doctor may have first tried to treat you with medicines and lifestyle changes, and it didn't work. So, like any surgery, there are risks for a coronary bypass surgery. Any surgery risks, you can have blood clots in the legs, and these blood clots can travel to the lungs. You can have breathing problems, infections in the lungs, urinary tract, and chest, and you can have a blood loss and stroke. And then, of course, if you have a stroke, you can have a brain damages. The specific risks for this surgery are a chest wound infection, which is most likely to occur if you're obese, diabetic, or have already had the surgery more than once. You can have a heart attack or stroke, heart rhythm problems, or kidney and lung failures. You can also have a low fever and chest pain. Together, these two symptoms are called post-pericardiotomy syndrome, and they can last up to 6 months. You can also have memory loss, loss of mental clarity or fuzzy thinking, pneumonia, and breathing problems. The pre-surgery, so there's certain things you want to do before the surgery. For the 2-week period before the surgery, you may be asked to stop taking any drugs that make it harder for your blood to clot. So these might include aspirin, ibuprofen, naxaprin, and other similar drugs. If it's hard for your blood to clot, it can cause a couple complications during the surgery. If you're taking certain medications, talk to your surgeon about when to stop taking them. Ask your doctor which drugs you should still take on the day of the surgery. If you smoke, you want to ask your doctor for help. You ideally don't want to be smoking while you're getting ready to have the surgery done. You also want to contact your doctor if you have a cold, a flu, fever, or herpes breakout, or any kind of illnesses. This can also compromise your health after the surgery, so you are more likely to get an infection if you have a cold or if you have something going on with the body that shouldn't technically be going on. Before the surgery, you want to prepare your home so you can move around easily when you return from the hospital. So if you have a bathroom downstairs, that's great. If you can move your bedroom kind of downstairs, that's a good idea too. On the day of the surgery, you're asked not to drink or eat anything after midnight before the surgery. If you're brushing your teeth, you can rinse your water, you can't swallow it. If you have to take medications, with the doctor's permission, you are allowed to take a very tiny amount of water with the pills. After the surgery, you'll spend 3 to 7 days in the hospital. You'll spend the first night in an intensive care unit, also known as the ICU, and you'll probably be moved to a regular or transitional care room within 24 hours. You will have 2 to 3 tubes in your chest to drain the fluid from your heart, and they will most often be removed 1 to 3 days after the surgery. You can also have a catheter in your bladder to drain your urine, and you may also have IV lines for fluids. You'll be attached to machines that monitor your pulse, temperature, and heart rate and breathing, and nurses will constantly watch your monitors. So it's not a very restful time in the hospital that you're going to spend after the surgery. You'll be encouraged to restart some activities, and you may begin a cardiac rehabilitation program within a few days. It takes 4 to 6 weeks to start feeling better after your surgery is done. So if by the first week you're not feeling that good, that's okay. By week 6, if you're still not feeling good, you're having a slow progress. Your healthcare provider will then give you instructions on how to take care of yourself after the surgery. Then, when you leave the hospital and you're at home, there are 2 things that you definitely need to do. You need to keep your surgical area clean and dry. If the surgical area becomes moist, you have a higher chance of getting an infection within that area. You also want to notify your doctor if you have any fevers, chills, bleeding, or leakage from the draining from the incision site, or increased pain around the incision site. They do recommend that you can begin your exercise within a couple of weeks. Within a couple of weeks of within the surgery. Okay, so the first article was called "The Cardiac Rehabilitation versus Home Exercise After Coronary Artery Bypass Graft Surgery." It's a comparison of heart rate recovery by Wu Shi Quinn. So the purpose of this article was to study and investigate whether the cardiac rehabilitation exercise program had a positive effect on heart rate recovery in patients having undergone CABG, and to compare the differences in heart rate recovery between cardiac rehabilitation and home-based exercise programs after 12-week interventions. All subjects had pectoris angina with or without pulmonary edema, but none of them had acute myocardial infarction. Catheterization was performed by cardiologists, and a CABG surgery was recommended and performed. Patients included people that had no previous surgery like this one done before, no neurological impairments such as stroke or traumatic brain injury, no severe musculoskeletal injuries such as amputations. And the patients excluded from this test were if they displayed uncontrolled dysrhythmias such as a flutter, fibrillation, or continuous ventricular tachycardia. And this would have been observed during the exercise testing phase at the beginning of the study. So there were 54 people that were eligible to have been a part of the study. Group 1 was a cardiac rehabilitation exercise program, and it enrolled in 30 to 60-minute aerobic exercise training sessions, which included riding a bike or jogging on a treadmill, with intensity that corresponded up to 85% of their peak heart rate during the peak heart rate that was found during their during the original stress test. There were 10 minutes of stretching exercises or calisthenics for warm-up and for cool-down, and the heart rate and blood pressure and exercise intensity were monitored. This training happened 3 times a week, and this lasted for 36 exercise sessions. Group 2 was a home-based exercise program where patients were instructed to conduct a home-based exercise program with an intensity corresponding to 60 to 85% of their peak heart rate, and patients were advised to exercise at least 3 times per week. Each exercise session lasted 10 minutes for a warm-up, 30 to 60 minutes of aerobic training, which included fast walking or jogging, and a 10-minute cool-down. Group 3 was the control group, and they maintained their normal levels of daily physical activity without specifically instructed exercise programs. Participants were tested with a cycle ergometer using a 1-minute incremental protocol, and they had a 12-lead ECG attached to them. All groups were found that their resting heart rate was improved, heart rate recovery, peak heart rate, workload, and peak oxygen consumption at the follow-up was also compared with their baseline information. The results showed that a significant improvement with the resting heart rate and heart rate recovery in patients that had undergone the surgery after 12 weeks from the cardiac rehabilitation exercise program. Although the home exercise program did not have significant differences in resting heart rate and recovery from those groups, it had statistical improvements that were comparable with the cardiac rehabilitation group at the follow-up tests. The improvements in peak heart rate, workload, and peak oxygen consumption at follow-up in the cardiac rehabilitation were consistent with those in previously published studies. All three groups had higher resting heart rates at the baseline after the baseline testing. So Article 2 was the physical activity and lean body mass loss following coronary artery bypass graft surgery, and this was done by Shaw, DK. So the purpose of this study is to investigate the role of phase 1 exercise therapy in the improvement of lean body mass following the surgery. There were 30 male cardiac patients ranging in ages from 35 to 74 years old, and all patients had undergone this surgery. I'm sorry, excuse the train behind me. The exercise regimen started 24 hours after the surgery, and the exercise groups lasted 10 to 20 minutes, twice daily. The exercise regimen began as a passive range of motion, so they were stretching, and they had bedside calisthenics, walking, and stair climbing by the time of discharge. 2 exercise sessions were conducted daily, one in the evening and one in the morning. They also documented their caloric intake, so how much food and how many calories they consumed within the day. And in order to look at this, they did take blood samples of each participant in the test. Subjects were weighed daily, and the weights were being obtained one day prior to surgery were compared with the weight after the surgery. The body weight of the exercise group was greater than that of the non-exercise group, both before and after surgery. 6 subjects gained weight, 5 of the 6 being exercise group, and they had excretion of UC increased for both groups initially, but after day 3, those levels did not fluctuate. So results showed that there were changes in lean body mass occurred in both groups, but less significant in the non-exercise group than there was in the exercise group. And that's it.